Is your liver disease pipeline future-proof? That's the question we're diving into today. The metabolic dysfunction associated steatohepatitis or MASH market is accelerating rapidly. With Rezdiffra, Madrigal's therapy already FDA-approved, and 𝗟𝗜𝗦𝗦𝗘𝗧 therapy in phase 3, the competitive field is narrowing quickly. And if you're entering the space now, you're likely competing for residual market share in a space that is already being defined by the early movers. Moreover, with high clinical attrition rates and increasing commercial saturation, the road ahead for MASH drugs is littered with obstacles that threaten to diminish your return on investment. So what do MASH leaders have in common? They've diversified into high-need liver indications where there's less competition. And they've done so by looking beyond the chronic stable hepatitis segment and addressing unmet needs across the liver disease continuum. Take Madrigal Pharmaceuticals, for example. They defined the MASH space with the first FDA-approved therapy for MASH and gained an early mover's advantage with Rezdiffra. Alnylam Pharmaceuticals is another example, a leader in RNAi therapeutics targeting hepatic pathways. Their approach showcases modality innovation, offering a new tool in the fight against liver disease. And then there's Regeneron Pharmaceuticals advancing both antibody-based and fibrosis-focused therapeutics. Their pipeline, while diverse, hints at a potential crossover as advanced liver diseases often lack specific treatment pathways. These companies illustrate how scientific innovation and good timing can drive dominance in hepatic drug development. But without further diversification, your company could be relegated to the sidelines as the race for MASH market share intensifies. So the question remains, how can you stay ahead of the curve and maintain long-term commercial viability? The answer lies in identifying assets that not only address the gaps in the MASH market, but also extend your reach to other high-value liver disease segments. And here's where the hidden value of decompensated cirrhosis with Ascites comes into focus. With MASH drugs being contraindicated in this patient population, there's a significant unmet need for effective therapies. This segment represents a massive market opportunity worth over $2 billion globally. That's more than $9.5 billion, which is the projected MASH market size by 2030. Over 630,000 Americans have cirrhosis and 30 to 40% of them will progress to decompensation. Despite the huge disease burden, therapeutic development has remained stagnant. Most patients depend on invasive and temporary symptom relief strategies with few oral therapies and even fewer targeting the underlying pathophysiology of the disease. So here's the strategic outlook. The Biopharma's challenge isn't just about launching a MASH drug, it's about ensuring its long-term commercial viability. As the field of MASH consolidates around a few dominant players, adding an asset in decompensated cirrhosis with Ascites can help you extend your liver disease franchise into late-stage pathology. De-risk your pipeline through diversification and establish market leadership in an underserved high-value segment. By incorporating such an asset into your portfolio, your company will be positioned not just as a player in the MASH space, but as a comprehensive leader and liver therapeutics across the entire disease spectrum from prevention to cirrhosis complications. Thank you for watching this video. If you found it informative, please like and subscribe for more content. Also, don't forget to connect with us on social media. We look forward to seeing you at our upcoming events. Until then, stay healthy and safe.